Coronavirus Task Force met this morning, and now that we have cases in all 50 states, we're continuing to move out on the President's call to bring the full resources of the federal government, the full partnership with every state and territory, the full power of the American economy to support businesses and families. As the President says to us and every day, we'll do whatever it takes. We're all in this together. Yesterday, the President met with the tourism industry executives and also had an engaging discussion with all the top companies in our industrial and medical supply chain. The President, as you all are aware, also announced today that by mutual consent, the northern border to Canada will be closed to non-essential travel. This does not include essential travel or the transit of goods, but it was through mutual discussion that took place this morning between the President and Prime Minister Trudeau, and the Department of Homeland Security will be effectuating that decision. The President spoke with some of the nation's top business leaders today, again, to speak about the supply chain in the country. For our part, we're going to be conducting a conference call later today with state and local health officials to renew our ongoing commitment of cooperation and collaboration. As the President said last week in signing the Stafford Act, he stood up the National Response Coordination Center, and today at the President's direction, FEMA has gone to level 1. FEMA's mission is to support disasters that are locally executed, state managed, and federally supported. And tomorrow, the President will be hosting all the nation's governors from a video conference at FEMA to ensure that they have full connection to all of the activated regions for FEMA going forward. With regard to testing, I'm pleased to report that we're increasing the number of tests being performed by the thousands every day, thanks to the public-private partnership that President Trump forged with commercial laboratories around the country. Our health experts tell us to remind every American, it's important to remember, people without symptoms should not get tested. We want to make sure that the supply of testing is there for those that need it most or are symptomatic or in the vulnerable population. Dr. Deborah Birx in a moment will address the progress that we're making on testing, the infection rate, our recommendations to every American, as well as some important new findings about the impact on youth that we're gaining from data that's coming in from Europe that'll be important to every American. On the subject of supplies, the President has our task force extremely focused, as the President mentioned mentioned that he's invoking the Defense Production Act today. Secretary Esper in a few moments will describe the ongoing efforts that the Department of Defense is taking to make medical resources available. Secretary Robert Wilkie will announce decisions the VA has made to expand hospital capacity within their system. Also, with regard to medical personnel, at the President's direction, HHS is issuing a regulation today that will allow all doctors and medical professionals to practice across state lines to meet the needs of hospitals that may arise in adjoining areas. In addition to that, we are again today asking every American and our medical community leaders and hospitals to partner with us in delaying elective procedures across the country in our healthcare system to ensure that medical supplies and medical capacity go where they're needed most. Seema Verma will describe guidance that CMS will be issuing on that front. And finally, I want to remind every American of the President's 15-day guidance to slow the spread. We are grateful for members of the media and the general public that are adhering to these, sharing them with neighbors and friends. All of our experts continue to believe that if every American will do their part and embrace and put into practice these principles, that we can significantly limit the reach of the coronavirus in the weeks and months ahead.